All right, so let's get back into functional behavior assessment, and we're going to finish off talking about what that process looks like so that in the afternoon we can really look at what do interventions look like and what can we achieve with PBS-based interventions, okay? So we're going to, again, talk about indirect assessment, which is based primarily around interview. I'm going to talk about what direct observations give us in terms of data around problem behavior, and then we'll talk a little bit about what you might have professionals come in and do a functional analysis, which is a more experimental test to determine functional problem behavior, okay? But the first thing that should be done in terms of a functional behavior assessment is an interview. So your consultant, your behavior analyst, your behavior consultant, whichever, should be coming in and doing a functional assessment interview. Typically will take about 1 to 2 hours, and that usually is more about the experience of the behavior consultant often. So newer behavior consultants sometimes take a little bit longer because they're not as experienced with interviewing. The other thing that directly relates to how long an interview lasts is how many stories you tell as the parent or the teacher or the whoever is being interviewed. And so as an interviewer, I will often say, and I coach my students to say the same thing at the beginning of the interview, please don't tell stories. I'm going to ask you some specific questions and kind of try to just give me the answers. And I might actually cut you off if you start telling a bunch of stories. And the reason being not that I'm not interested in the stories, but really that I don't want us to be here till next Tuesday, and you don't want to be here till next Tuesday. And again, you're paying for a professional to do the interview, so you don't want to be paying for more time than you need to be paying for, right? So again, at the end of the day, you guys have limited funding dollars. You don't want to be paying a bunch of dollars to tell stories that we don't need to actually have. Does that make sense? Right, so for all kinds of reasons, try not to tell really long stories, although, I mean, I love just kind of sitting and hearing the stories because they're great stories, but we don't need the stories in terms of the functional assessment. And if we do need more specific information, then we'll ask for that, right? So that way, we're not wasting a bunch of your time, and we're also not wasting a bunch of your funding dollars at the end of the day, which is probably even more important, okay? The goal of indirect assessment is really, for me as the consultant or the behavior analyst, to get valuable information from you guys, the relevant sources who actually live with the child, who experience the problem on a regular basis. The kind of information that I'm looking to get is a good description of problem behaviors. I want to know what those behaviors look like. I want to know how intense they are. Are people getting hurt? Are things being broken? Is it kind of like not very annoying, but not damaging, right? Some behaviors are just annoying. I want to know how long behaviors last. I want to know all kinds of stuff about behavior. I also want to know about physical and environmental factors that might influence behavior, and we're going to talk in a few minutes about what specifically some of those things might be. But again, think back to those of you who require coffee in the morning, right? That would be an environmental kind of factor, but we're talking about sort of broad influences that make it more likely that an individual might engage in problem behavior. How many of us are a bit more likely to engage in problem behavior if we're sick? Right? If we have a headache, right? We tend to be a little more snappy, right? A little bit more on edge. So those are the kinds of broad environmental factors that we're talking about. Physical disabilities, right? So some individuals have actual physical impairments that may cause pain, for example. And so that, again, if you're in pain a lot, you're probably more likely to engage in problem behavior. So that I want to know that kind of stuff. At the end of the day, I want to know about the function of problem behavior. So I'm going to be asking about those triggers that cause problem behavior, and I'm going to ask about the consequences, what happens right after problem behavior that seems to be paying it off. And from that information, I'll get a sense of the function. Okay, so when I'm talking about description, what do the behaviors look like? How often? How long does an episode last? How intense is it? And part of this, the reason why I want to know this is so that when I'm watching behavior, I can actually know what I'm looking for. The other part is sometimes I'll prioritize based on the intensity of problem behavior, right? If a kid is engaging in really severe self-injurious behavior that's causing physical damage, that's probably the first thing I'm going to do over the annoying but not harmful screaming. Right? So understanding the intensity of behaviors may play a role in determining what we address first, second, or third sometimes. When I talk about setting events, so these are those broad physical and environmental factors, we're talking about things like medications. Does your child take medications? And not just does your child take medications, but if so, what are the side effects of those medications, and does that perhaps play a role in problem behavior? Right, so some individuals take, for example, atypical antipsychotic medication, Risperdal, for example, which has a whole host of side effects like headache, stomachache, nausea, all kinds of other things, which may actually be a factor in problem behavior if the medication you take helps in one way, but also makes you feel somewhat unwell in another way. That may play a role in problem behavior. So if that's going on, I kind of want to know that. Or for example, if I've got kids who might take seizure medication and their seizure medication makes them somewhat tired, that makes it a little more likely that they'll engage in problem behavior. So I need to know those kinds of things. I want to know if there are particular medical problems that a person has. So asthma, allergies, any other kind of medical issues that may interfere or make problem behavior worse. I want to know about sleep and sleep cycles. Is this a kid who sleeps regularly, gets a full night of sleep, sleeps well, not an issue? Or is this a kid who either doesn't sleep very well or has poor sleep, interrupted sleep, and is being tired or a lack of sleep related to problem behavior? So on days when the child hasn't slept well, is the child more likely to engage in problem behavior? I want to know about those kinds of things. I want to know about eating routines and diet. Right? Particularly kids with ASD, they have a tendency to not have a very well-rounded and well-balanced diet. Many kids, yes, the food refusal kind of kids have that handful, 5 or 6 foods that they'll eat, nothing else. So sometimes for those kids, they're actually not getting a really well-rounded, nutritious diet. And who's had the sort of experience over like holiday, you go away for a weekend and you kind of eat nothing but garbage for a few days? And how do you feel after a few days of that? You feel a little foggy and you don't quite feel so good. Well, imagine if your entire diet is pretzels and frozen fish sticks and whatever other sort of, all of the white bland foods. A lot of kids with ASD are sort of white bland foods and then anything with sugar, right? Right, so imagine if that's all you're eating. Does that have an effect on your behavior? I want to know about the individual's daily schedule, and I actually look at, across the day, time, activity. What activities are problematic? What times of day seem to be problematic if I go through a child's schedule? I ask questions about predictability of the daily schedule. And so a lot of times when I ask this question, how predictable is the schedule for the person, people will say, oh, well, I tell him exactly what's going to happen, or the same thing happens every day, so he knows. And my response back is usually, how do you know he knows? Well, it's the same thing every day. But how do you know he knows? And then that's usually when I get the look going, oh, maybe he doesn't. Right, maybe he doesn't. So get in the head of the individual, really from the individual's perspective. Does that individual know what's going to happen, at what time things are going to happen, how things are going to happen, with whom he's going to be with, where things occur, when things will stop? There's an awful lot of information that goes into the schedule of the day. And we're talking about a lot of kids who have difficulty with communication, difficulty remembering information, difficulty understanding information. So imagine if the day is not very predictable. Anybody ever have the experience where you lose this and your schedule is gone and you, are now in that state of panic of, I don't know where I'm supposed to be right now. You've had that experience, some of you. Imagine being like that every single day. And also not having the ability to ask somebody, right? If you don't have really good communication skills, you can't say, oh, well, excuse me, what is my schedule today, right? So lack of predictability often plays a role in problem behavior. So I want to know about that. I want to know about choices that the individual gets to make. Is the individual making a lot of choices during the day? Or are people making choices for the kid? And again, this doesn't mean that we're going to let the kid decide when he goes to bed and what food he eats and whether or not he eats, whether or not he has a bath. But we can embed a lot of choices, typical things that kids choose. Often, what color shirt or pants do you want to wear? What toys do you want to play with? Do you want to play inside or out? I mean, we can give kids choices across the day, and some kids get choices. Some kids don't get many choices at all, and it seems like that might be associated to problem behavior, right? Especially if their problem behavior is around people demanding that they do stuff, telling them, okay, now you have to do this, and now you have to do this, and now you have to do this, and they're never wanting to do anything. Sometimes giving those kids some little choices, giving them a bit of control over part of their day, makes them so much more amenable to doing what other people ask of them, right? I mean, and again, we're all kind of like this. If we lived in a land where everybody told us what to do all day, at some point we would determine that that was enough, right? And I don't know, for me, it would take maybe an hour, right? Maybe some of you are a bit more patient about that, but if somebody was telling me what to do all the time, it wouldn't be long before I was unpleasant. I ask questions about the number of people in the environment, who's in the environment, how that affects problem behavior. Some kids do quite poorly in crowded, noisy environments. Those are things that are really difficult for kids. And again, does that mean we're never going to put you in a noisy environment? Not at all. But we might need to address some aspects of that. We might need to do some teaching, right? But if I understand that crowded, noisy environments are difficult for you, that helps me understand why going to the mall at Christmas time is problematic. Right? How many of us avoid Metrotown like the plague as soon as, right? We're already there. I probably at about this point, I don't want to go in. Right? I don't go there very often now for that reason, because it's kind of like Christmas all year round now there. But in December, it's like a nightmare. So I just don't go. But imagine, again, if you're a kid who does poorly in sort of crowded, noisy environments and people are taking you into these environments, you have no way of saying that to anybody. What do? You drop on the floor kicking and screaming so that people take you out of there, right? Makes sense, right? We'll need to teach you how to handle some of those things, because sometimes we have to suck it up and just do it. But how can we support that person? Staffing patterns and interactions. Now, I know that with young kids, there aren't often a lot of staff, although there are often VIs coming into the home, or your kid might be going to a program. Also at school, staffing patterns, but I also want to know about just interactions with mom and dad and the babysitter and grandma and grandpa, because often some people tend to do better with the kid than other people. Some people seem to have more problems than others, and I actually try to look at, well, what are some differences in terms of how people interact? Right? If I'm looking at people who seem to have few problems with the kid, how do they interact with that kid? Are they the kind of people who are kind of a bit jokey and funny and they kind of joke the kid into doing? Or are the people who seem to have more problems, more stern, more direct, more firm? Does that seem to be associated? Can I learn something from the people who have fewer problems that we might be able to use in terms of how we interact with the person, particularly when we're teaching new stuff? So I want to know about those kinds of things, patterns of staff interactions. Is this a kid who does better kind of in a one-on-one situation, or is this a kid who really hates having the adult tied to me all the time, right? And just get away from me. Because some kids don't want that kind of person standing over them. Not such a good time. So I want to know those things. I want to know about antecedents. So antecedents, that's the ABA word for trigger. And some of the things that I'm thinking about, are there particular times of day that are associated, particular activities that happen at particular times of day? Places or physical settings that seem to act as a trigger. Specific people. Specific activities. And usually, when we're looking at these things, it's some sort of factor here that's related to time of day or places or people or activities. So often it's a task demand, right? A demand to eat your dinner, a demand to take a bath, a demand to clean up your toys, a demand to do your homework, a demand to go to sleep, right? Parents give demands to their kids all day long. That's what parents are supposed to do. Sometimes it's about interruptions. Child is playing along happily with favorite toy, and you come along and say it's time to stop that and do something else, and everything falls apart, right? You interrupt me while I'm doing something. Transitions, often a problem. A delay, having to wait. How many have kids who are not fans of the waiting game, right? How many of us are not fans of the waiting game, right? The apple doesn't fall far, right? Lack of attention, right? So parent or adult is busy and I'm left to do my own thing. I don't have attention right now. That serves as a trigger. So we're looking to understand what are the things that seem to set off problem behavior. And then we're looking at consequences. So I want to ask the parents, ask whoever else I'm interviewing, about the general consequences. What follows problem behavior? Is the person getting something? Getting access to an item, a toy, a food? Getting access to an activity? Getting attention or interaction from another person? Is the individual avoiding something, either altogether, right? Avoids doing a task altogether. I avoid sitting at the table and eating a meal with my family. I'm allowed instead to just graze. Or delays something. Eventually the kid gets in the tub, but it's like an hour and a half after I wanted him to get in the tub. There's a long delay. Okay, so I want to know those kinds of things. I also want to know about the efficiency of the behavior. I want to know how well does the problem behavior work for that person. Right, so think about that. How well I engage in a problem behavior. Do I get what I want right away? Is my problem behavior pretty low effort? Or do I have to kind of like work really hard to get what I want? I have to engage in lots of problem behavior before somebody gives in. So I'm thinking about physical effort. I'm thinking about how often I get reinforced. Do I get reinforced every single time I engage in the problem behavior, or just sometimes, right? Reinforcement's immediate, reinforcement's delayed. All of these things I need to take into consideration, because when I'm teaching a new behavior, I need to make sure that the new behavior works at least as well, but ideally better than the problem behavior. All right, so think about this. If a kid is engaging in problem behavior to essentially get a break from a task, and I'm going to teach the kid to ask for a break. If asking for a break, if I decide to, excuse me, Mom, may I please have a break at this moment? That's a very difficult thing, right? We would never actually do that, but it makes a good example. Difficult versus I scream and Mom takes the work away. Right? So if I'm trying to teach, excuse me, Mother, but may I please? The kid's gonna go, are you kidding me? Like, I can scream and the work is gone. I'll just keep with the screaming. Right? So we need to make sure that whatever we're teaching instead is at least as easy and effective as the problem behavior. Otherwise, well, why would I switch to this new behavior? I'll just keep doing what works, because it works faster and better.